Hello and welcome to this educational video on the flu. In this video, we will explore the basics of the flu, including what it is, how it spreads, symptoms, treatment, prevention, and more. The flu, or influenza, is a viral infection that affects the respiratory system. It is a common illness that can range from mild to severe, and in some cases, it can be fatal. The flu can affect anyone, but certain groups, such as the elderly and young children, are more susceptible to complications. So, let's start by understanding what the flu is and how it spreads. What is the flu? The flu is a viral infection caused by the influenza virus. There are several types of influenza viruses, including A, B, and C. Influenza A and B are the most common types that cause illness in humans, while influenza C usually causes mild respiratory symptoms. The flu virus spreads through respiratory droplets that are released when an infected person coughs, sneezes, or talks. These droplets can land in the mouth or nose of a person nearby, or on surfaces that people touch. The virus can survive on surfaces for up to 24 hours, which means that someone can become infected by touching a surface contaminated with the virus and then touching their mouth or nose. Symptoms of the flu. The symptoms of the flu can vary from person to person and can range from mild to severe. The symptoms usually appear 1 to 4 days after exposure to the virus and can last for up to a week. Some of the common symptoms of the flu include fever, cough, sore throat, runny or stuffy nose, body aches, headache, fatigue, chills. In some cases, people with the flu may also experience vomiting and diarrhea, although these symptoms are more common in children than adults. Complications of the flu. In most cases, the flu is a self-limiting illness that resolves on its own within a week or so. However, in some cases, the flu can lead to complications, especially in people with weakened immune systems or underlying health conditions. Some of the complications of the flu include pneumonia, bronchitis, sinusitis, ear infections, dehydration, worsening of chronic medical conditions such as asthma or diabetes. In rare cases, the flu can also lead to life-threatening complications such as sepsis or organ failure. Treatment for the flu. There is no cure for the flu, but there are several treatments that can help alleviate the symptoms and reduce the risk of complications. Antiviral medications are the most common treatment for the flu. These medications work by stopping the virus from replicating in the body, which can shorten the duration and severity of the illness. However, antiviral medications are most effective when taken within the first 48 hours of symptom onset, so it is important to seek medical attention as soon as possible if you suspect you have the flu. In addition to antiviral medications, there are several over-the-counter medications that can help alleviate the symptoms of the flu, such as fever reducers, cough suppressants, and decongestants. It is important to follow the instructions on the label and talk to a healthcare provider before taking any medication. especially if you have underlying health conditions or are taking other medications. Rest, hydration, and supportive care are also important for managing the flu. It is important to stay home and avoid contact with others to prevent the spread of the virus. Prevention of the flu. The best way to prevent the flu is by getting a flu vaccine every year. The flu vaccine is recommended for everyone over the age of 6 months, especially those who are at higher risk of complications, such as the elderly, young children, pregnant women, and people with underlying health conditions. The flu vaccine works by triggering the body's immune system to produce antibodies that can fight the virus. It is important to get vaccinated every year because the flu virus changes constantly, and the vaccine is updated each year to match the most common strains of the virus. In addition to getting vaccinated, there are several other measures that can help prevent the spread of the flu, such as wash your hands frequently with soap and water or use hand sanitizer. Cover your mouth and nose when coughing or sneezing. Avoid close contact with people who are sick. Stay home if you are sick. Clean and disinfect surfaces and objects that may be contaminated with the flu virus. It is important to note that the flu vaccine is not 100% effective, and some people may still get the flu even after being vaccinated. However, studies have shown that the vaccine can reduce the severity of the illness and the risk of complications. Flu season. The flu season typically runs from October to May, with peak activity occurring between December and February. The timing and severity of the flu season can vary from year to year, depending on several factors, such as the circulating strains of the virus and the effectiveness of the vaccine. During the flu season, it is important to take extra precautions to prevent the spread of the virus. This may include avoiding crowded places, practicing good hygiene, and getting vaccinated. COVID-19 and the flu. The COVID-19 pandemic has brought a renewed focus on respiratory illnesses, including the flu. While COVID-19 and the flu are caused by different viruses, they share many similarities in terms of symptoms and transmission. Like the flu, COVID-19 spreads through respiratory droplets and can cause fever, cough, and fatigue. However, COVID-19 can also cause more severe respiratory symptoms and has a higher mortality rate than the flu. The COVID-19 pandemic has also highlighted the importance of getting vaccinated and taking measures to prevent the spread of respiratory illnesses. It is important to follow public health guidelines and get vaccinated for both COVID-19 and the flu to protect yourself and those around you. Conclusion. In conclusion, the flu is a common viral infection that affects the respiratory system. It spreads through respiratory droplets and can cause a range of symptoms, from mild to severe. While there is no cure for the flu, there are treatments that can alleviate symptoms and reduce the risk of complications. The best way to prevent the flu is by getting vaccinated every year and practicing good hygiene. During the flu season, it is important to take extra precautions to prevent the spread of the virus, especially in light of the COVID-19 pandemic. Thank you for watching this educational video on the flu. Remember to stay informed, stay healthy, and take care of yourself and those around you. Please like and subscribe to our channel. Have a nice day.